Hi everyone, my name is Dr. Vivian Asamoah. I am a GI specialist based in Houston. And today I want to take a minute to talk about irritable bowel syndrome, IBS. I want to highlight one fact. IBS is extremely different in everyone. And so one therapy that may work for your sister, your hairdresser, or even is proposed by your GI doctor may not work for you. And that's because IBS is extremely heterogeneous in its presentation. And when we say heterogeneous in medicine, we just mean like it's just in anything, it's just diverse, it's just patchy. It's like everyone presents totally differently. Everyone's symptoms are different. Like some people have diarrhea, constipation, some of them is mixed. And so response to treatment and even what works for you could be totally different. So let me just highlight one thing. When it comes to food, we see the same heterogeneity. So I don't want you guys to get all into one person talking about, oh, this diet's definitely gonna work. This is totally gonna work for you. This is the diet. This is the way to go. Because even in the scientific literature, when we look at the low FODMAP diet, which is sort of the recommended diet for IBS, it only works in about 40 to 50% of our patients, right? And so it's not the diet for everyone, although it's the one we talk about the most. I have patients and I recommend the low FODMAP and they're like, didn't work, nothing happened. And then I have some patients who are like, whoa, I just avoided half the things on the low FODMAP and I got totally better. So again, one thing you're going to take from this, your IBS is not the same as my IBS, is not the same as Jack's IBS, and is not the same as Susan's IBS. We're all different. And that's where personalization of care comes in. So in my practice, sometimes it's going to be the low FODMAP diet that works. I'll assess the patient and really customize a protocol because sometimes it's a low histamine diet that works. Sometimes it's simply just a wheat intolerance or fructan intolerance, and that works. Some of my patients go plant-based and that works great. Some of them go plant-based and they're like, oh, I'm so bloated, I can't, right? A few patients have decided to go more protein-based, carnivore diet, I would say more protein, keto diet, and have had better relief. And now there are studies looking at Mediterranean diet in patients with IBS. So exactly the same thing. It's not the same thing. It's not a one size fits all. What works for Tim may not work for Tom. And you really have to partner with a physician and a dietitian who completely understand the heterogeneity of IBS and can help you personalize and customize a plan that works for you. Because we do know that I would say 80% of IBS is triggered by food or stress, and finding the right protocol for you in terms of what to eliminate, how to bring foods back, and how long it's going to take is really, really important. So working with the right provider is key. All right. My name is Dr. Vivian Asamoah. I'm a GI specialist in Houston, Texas. If you found this interesting, continue to like us and follow us for more information on gut health.